So welcome to this Module 3D presentation that discusses communication in your caregiving career, because what you do as a caregiver is a lot of communication, either verbally or non-verbal, in one way or the other. To effectively communicate, we must realize that we are all different in the way we perceive the world, and therefore use this understanding as a guide to our communication with others, says Anthony Robbins. Communication is the process of exchanging information with others and is a means for two or more people to connect. So it's a way you exchange information with your clients, with your patients. It's a way for the two of you to connect, and it's a way for you and the family to connect. Communication is an essential part of the job of a caregiver. You must be able to communicate with your supervisor, with members of the healthcare team, with the patient, with the family, and eventually, essentially everybody that would work together to see that the patient is well. The principles of effective communication include the sender. The sender is the person who receives the message. The receiver is the person, sender is the person who sends the message. Receiver is the person who receives the message. Feedback is what the receiver responds to the message in some way to let you, the sender, know that they've heard you and understood the message. Like if I say come, and I'm the sender, and the receiver says, okay. Okay, what does that okay mean? Except I get the feedback that the person actually does start coming towards me. That's the feedback I expect. If the person says okay and does not come towards me, then I begin to wonder, does he or she understand what come means? Because if it's someone who does not understand English and I just say come, and out of politeness smiles and says okay, she may have assumed that I said come means God bless you. She may have assumed that I said come mean I'll see you later in the evening. So the feedback lets you know that the receiver heard you and understood the message. So feedback is very important in communication. So when you communicate with your client, you should be able to ask, so do you understand what I said? What did you get from all that I've explained to you so far? Or maybe you need to carry out an activity with the patient for which you need permission, you need consent to be able to go ahead. So that you've told the person and the person has heard you. You still need that feedback to know, okay, now do you understand me? So does that mean I can go ahead? Please, I need a feedback from you. So you wait for the feedback before you go ahead. So it's especially important in your work as a caregiver. You must take the time to ensure that your patient understand the message you're trying to convey. Now, during communication, there's a repetitive cycle of sending, receiving feedback between the persons that are communicating. Now, there are two types of communication. There's the verbal and the non-verbal. Verbal communication involves the use of words or sounds, which are spoken or written. Non-verbal communication is the way we communicate without using words, your body language, some non-verbal cues, some nods, even the eye contact, physical touch. They are all non-verbal ways of communicating. So some non-verbal communication will include shaking your head as in no, nodding your head as in yes, rolling your eye could be out of contempt, could be out of disbelief, could be out of disagreement, smiling or crying. They are all non-verbal methods of communication. So the receiver of the communication sees the non-verbal communication that the sender demonstrates in addition to hearing the spoken word. It's possible to say one thing and act another thing. The tone of voice is another important non-verbal method of communication. So the tone of a person's voice would often reflect their mood and can convey a different meaning to a sentence. There are many ways you can say please. Oh, please, I'm so sorry about that. Or oh, please, like the person is really getting on your nerves. It's still the same thing, but there's a tone of voice that lets you know that oh, please means two different situations. So the tone of a person's voice, again, can reflect their mood, can convey different meaning to a sentence. For example, when you say, oh, really, with emphasis on the oh to convey your surprise. And you can also take the same sentence and emphasize the really, and it changes the meaning to a state of being of disbelief or sarcasm. Oh, really? You understand? So the non-verbal cues are just as weighty as the words you used. So saying the same sentences with a different tone of voice and emphasizing certain words sends a completely different message. Body language is another form of non-verbal communication. The way we sit or stand with your shoulders forward or slouched, the way we hold our arms either crossed in front of our chest or at our sides, all convey a message to the receiver. The way we use gestures, touch, and even silence also tell the receiver what we are feeling. Now, sometimes some people say one thing and mean another thing. You send one message verbally and quite another message non-verbally. And we can often tell a person's true feelings with a non-verbal message more than a verbal message. So as a caregiver, it's important for you to be aware of these incongruous messages, especially in your patient. So if a patient tells you I'm feeling fine, and yet they are sighing and sitting with their shoulders slumped down, and they appear to be crying, that's a good indicator that there's a verbal and non-verbal incongruency. So it's your place as the caregiver to probe, and try to get the truth out of the patient. And when you notice these confusing messages, you should try to find out if they are correct in their thinking. You say something like Mrs. Martin, you say you feel fine, but it looks like you've been crying. Because Mrs. Martin may have dementia, may have Alzheimer's, may really not be in touch with her emotions and her words cognitively. So it's your place as the caregiver to be able to really know what Mrs. Martins is saying. Is what she's feeling really congruous with what she's saying? And this will help you to clarify if you have understood the message and can help you open up the lines of communication for important and honest discussion between you and your patient. It's also important to be aware of the congruence in your own verbal and non-verbal messages. Does your body language match the words you speak to your patient? Is your tone of voice upbeat or is flat and uninviting? You can say, oh, I'll be glad to help you. But you say it in a flat, uninviting way. The patient will pick up on the non-verbal cues and they know that, okay, you're not really willing, you're not really glad to help them. You are just doing it because it's a duty that needs to be done. Then as you communicate, are you making eye contact with the patient and smiling as you tell them you're glad to see them? Or are you looking at the floor when you say this rather than their eyes? Patients will read into these mixed messages and they will feel that you, the caregiver, you're not really glad to see them or to be of help to them. So what are some barriers to effective communication? Language barrier. If a patient's first language is a different language than that of the caregiver, it's important you speak slowly, clearly with short and simple messages. Then you consider using pictures or pointing to objects if it's difficult to explain or for the patient to understand certain words. For instance, if the patient is having trouble understanding when the caregiver asks if he would like to use a bedpan, they could show or point to the bedpan to convey their message. So you can point in the direction of the bedpan the way people tell children, potty. Potty is all the child knows when he's being potty trained and he knows what that means. So if you have a patient who has some form of language barrier, you point at the object just to demonstrate the gesture of what it is you're trying to communicate with words. Now, if your patient does not speak the same language with you, you should be able to speak with your supervisor about using a translator to assist you in communicating with your patient so you can provide wholesome care. And in some instances, some family members may be used for translation. But it's important to also know that some patients will not want to say what needs to be said in front of the family members, in families that are not so closely knitted, in families that are sources of stress, or in a situation where a patient is scared of making their family members uncomfortable because of the request or the wish that they would like granted. Another barrier to communication is hearing impairment. In patients who have hearing impairments, meaning they have difficulty with hearing or they are frankly deaf, you must be sure to be standing in front of the patient so that they can see you during conversation. For some of them, they may be able to lip read. For those who understand sign language, if you do understand sign language as a caregiver, that's a plus. But some deaf people are able to lip read, but be sure you're standing in front of them where the patient can see you. Now, if they have hearing aid and they're not hearing you, You want to check to be sure that the volume is turned up high enough and the batteries are in good working order, or the hearing aid is charged. Now, someone with hearing impairment, you want to speak in low, clear, and pleasant voice. Be careful not to shout or yell at your patients. Now, when you shout or you're yelling at the patient, your aim is that they should hear you, but really it doesn't help them hear better. Rather, when you shout, they may perceive some body language that they are being yelled at, or that you're angry with them, or that there is a source of burden. So be cautious not to express non-verbal cues of being frustrated with your patients. Now, for someone who has visual impairment, it's important to know that voice is not the only part of conversation. Sight is also a part of conversation. Imagine if you close your eyes and someone is talking to you. You don't have a full picture of such an experience. So it's important that you're, as an individual, are able to see body language and facial expressions in order to understand the full effect of messages. Now, an individual with visual impairment will probably not be able to do this. But if your patient wears glasses, you want to be sure that the glasses are on and the lenses are clean so they can better see you and get a full effect of the message you're communicating. And in persons who are legally blind, you want to explain detailed information to them that they cannot pick up without seeing. For example, if you are reading to such a patient and there's a picture that comes up, you want to describe the picture for them as best as you can. When you're serving meals and you place utensils, you should be able to describe and tell them the location of the utensils. Is it on your right hand side? Is it on your left hand side? Be able to communicate that with your visually impaired patient. Then a patient who has speech impairment would make it difficult to send messages so that others can understand. They can hear you, but they cannot really communicate with you. Aphasia is a language disorder in which a patient has difficulty understanding or expressing language. People can develop aphasia as a result of stroke, brain injury, or dementia. So you want to listen very carefully to what the patient is trying to convey. Sometimes they may be saying one thing and mean another thing. Sometimes they are trying to demonstrate it with all of their fingers, with all of the facial expression. It requires you as a caregiver to be very patient and intentional and have the sixth sense to be able to pick what your patient is communicating with you. Then if you don't understand, it's important to also ask for clarification if you're not sure of the word. And so not just that you're there and you're just nodding and agreeing, even if you do not understand. And it may be more frustrating frustrating for both the caregiver and the patient when there's that speech impairment and you cannot understand what the patient is trying to communicate. So in some instances, alternatives to voice may be used as a means of communication if it's just speech impairment and the person can put it in writing, or the person can point to a picture to tell you what it is they are trying to communicate. Point to a picture of the toilet, meaning I want to go pee or poo. Point to a picture of food, meaning I want to eat. Point to a picture of water, meaning I want to eat, I want to drink. Point to a picture of the bed, meaning I want to go and sleep. Just employ all the tactics that will make it such that you can reduce the communication barrier between you and your patient. Cognitive impairment. If a patient has a cognitive impairment, it means that they have difficulty processing or understanding information and they take extra time when explaining something or when you are explaining something to them. And they may need a longer period of time to try and understand the message that is being sent. So as such, you want to avoid very long sentences. You don't want to speak in paragraphs. You want to speak in short, brief sentences of at most 4 or 5 words. You want to eat. Do you want to pee? I need to bathe for you. I need to help you brush your teeth. I need to give you your medication now. And just brief sentences without being unduly verbose. Then you would allow time for the patient to process what you have said without moving on to the next sentence or topic. And you would even wait for a feedback. So do you understand what I've said? What did you hear me say? And sometimes the patient will agree with you even when they do not understand what you have said. So it's important to be very, very aware of this so that you don't do something that is not in the best interest of the patient, even though the patient agreed without really understanding. Then some of them may also be very embarrassed and they may not want to make you frustrated, so they just say yes. They just say yes. So remember to be patient, remember to be kind. There's an entity called informed consent in healthcare. The informed part means that the patient understands all that you have explained before they say yes or no. That is what you're going for in a patient who is cognitively impaired. So yes and no answers tend to shorten conversations. For example, if you ask a patient, does it hurt? Their response will either be yes or no. And this may also be very good for cognitively impaired patients if you have established that they understood the question. Now, if they respond yes, they are still unsure about the meaning and extent of the pain. If instead they ask, tell me about your pain, you're opening the lines of communication for the patient to be descriptive about the pain. And it's more likely that you understand what the patient feel and be able to care for them properly. So based on what the situation is, some cases you will employ yes and no answer. Some cases you will employ open-ended questions. How many children do you have? Result in a shorter conversation versus tell me about your children. Based on the patient you have, the situation on ground, the time you have, and the urgency of what needs to be done. There are some urgent situations where you have to employ a yes and no answer. But for situation where there's nothing at risk, try to use open-ended question in order to allow your patient the chance to speak in depth. Open-ended question will show the patient that what they have to say is important. Close-ended questions such as yes and no, like I said earlier, is for things that are urgent, things that are succinct, situations that a patient may not be able to communicate in that depth or variety of conversation as the case may be. Then asking why. When a patient makes a statement, is another way to quickly end the conversation. It also makes the patient feel defensive. So if a patient does not want to do something such as take a bath, don't simply ask why. Say something instead, such as, you usually have your bath. So what makes it different today? Why is that different today? Not just why. So tell me how you're feeling today. The patient may then be able to more likely tell you about their feelings, about their thoughts. Then cliches are catchy phrases that people use repeatedly and they do not really mean anything at all. People tend to use cliches when they are unsure of what to say. And the use of cliches, especially when someone is trying to convey their feelings, is a sure way to end the conversation. So statements like, oh, it will be all right, things will get better. I know just how you feel. I know just how you feel is a lie. You really don't know how anybody feels. You can only imagine what I would feel like. Or we are never given more than what we can handle. Those are just cliches. It stops conversations abruptly, especially when you're dealing with someone who is trying to pour his or her heart out to you. So phrases or cliches like this tend to end conversations, and they can make a person feel patronized as if you're treating them like a child. Now, active listening. The truth is most people do not listen with intent to understand. They listen with intent to reply. Active listening means what it sounds like. It means that you're fully concentrating on what is being said rather than passively listening or focusing on your own reply. So while the person is communicating with you, you're already contemplating the kind of response you're going to give to the person. And active listening is an essential skill for you as a caregiver. It demonstrates to your patients that you care and you're interested in them. Active listening means that you give the speaker or the sender of the message your full attention. It means that you use all of your senses while listening. It means you're paying attention to the words the speaker is saying and the non-verbal messages that are being expressed. It also means that you're conveying to the other person that you're interested in what they are saying. We demonstrate active listening by not only our spoken words, our body language, our cues, the monologues we respond with, okay, I hear you, I'm with you, tell me more. Things like that. Non-verbal messages such as use of eye contact, posture, nodding of the head, touching, facial expressions like smiling, convey the powerful message that we're actively listening to the speaker. So how do you become a good listener? One is you allow the person to express his or her ideas completely. You concentrate on what they are saying, and you're not trying to think your own response in the period the patient is communicating with you. You do not interrupt, except you want to interrupt for clarification. Okay, do tell me more about that. I really don't understand what you just said. Please say it again. Could you repeat? Could you tell me a little more? Okay, I'm with you. So those are the grounds on which you can interrupt, because you're really with the patient. You want to really understand what has been said earlier. Then you want to avoid finishing their sentences, even if you're in a hurry. If you know what they are going to say, if they have told you the same thing before, if they're having trouble communicating or are taking a long time to respond, because some patients who have dementia or Alzheimer's will probably tell you the same stories over and over again. If you want your patient to feel heard and you want to display the qualities of a good listener, you want to avoid finishing their sentences, even if they've told you the same story repeatedly. If you are finding it particularly difficult to not interrupt, practice counting to 10 when you feel the urge to interrupt. And you restate the message you heard the other person saying to you, just to ensure that you heard them correctly. This feedback will allow the speaker to correct any misunderstanding. You know, we said the message, the sender, the receiver, the feedback. So your feedback will allow the other person to correct any misunderstandings or if there are errors in what you've heard while they were speaking with you. Then you also want to provide feedback while you're listening to encourage the person to continue and show that you're interested. So leading statements such as "go on," "tell me more," "okay, I hear you, I'm with you," "yes," things like that will encourage the person to continue and demonstrate that you're interested in what they have to say. And you want to use body languages like nodding, and would encourage the person to say more. Some situations you want to allow for silence. Silence can be a powerful tool because it will allow the person a chance to fully explore and express their thoughts. Okay, so now when you're discussing very sensitive issues, sometimes silence is all you have to give. Your presence there, your giving that space to the person to just feel into what they're feeling and process their thoughts, even if you're not saying much. It's quite potent. So don't rush to fill in the silence with cliches, please. Then avoid changing the topic, even if the topic makes you uncomfortable. This conveys to the patient that you're not interested in what they're saying. For example, a patient might say, "I'm really afraid to die." Don't say something like, "Don't think like that. Come on, let's do something to cheer you up." Instead, you want to ask them, "Okay, tell me about it. What makes you feel like that? I'm here with you. You can just open up to me." Just leading phrases that will allow the person to explore their thoughts and their emotion around the fear of death. Then use your body language to demonstrate that you're interested in the other person. You stop the task you are doing. You put your full attention on the person in front of you. Stand, or better yet, sit facing them. And if it's appropriate in the culture where you work, you want to make eye contact with the person who is communicating with you. If it's an individual who enjoys touch as a means of communication, your elderly patient, you want to gently touch their hand or arm while they are talking with you. You want to use facial expressions to convey your interest and attention. If appropriate, if what is being conveyed is something you can smile about, you smile. Or appear concerned if it's a difficult topic that is being discussed, and you lean forward to express your interest. Do not cross your arm, do not slouch as if the conversation is a source of boredom to you. Then still part of being a good listener means that you have to be aware of cultural differences. Get to know your patient's culture and what is acceptable. Like why we said, if it's someone who enjoys touch, you may want to give a pat on the shoulder, a pat on the arm, on the forearm. Also be sure that it's culturally appropriate wherever you find yourself working. Eye contact, you also want to be sure it's culturally appropriate. Then you learn the words and expression of a patient's culture to fully understand the messages they're trying to convey. And when in doubt, you want to ask your patient to explain what a phrase or an expression means. Do not assume that you understand. Do not talk to an elderly or disabled person as if they are a child. Talk to them as if just the same way you will talk to any other person. Don't call elderly people names like honey, sweetheart, dear. Those are names you would reserve for persons that are dear to your heart, or your own children, or smaller children that you're privileged to raise or supervise, not for elderly persons or disabled person whom you care for as a caregiver. So you call them by the name they wish to be called. Maybe it's Mrs. So and so, or Mr. So and so, or just James, or just John. And it's important when you resume work that you ask the patient upfront, how would you like to be referred to, sir? How would you like to be referred to, ma? Some people may find it inappropriate if you call them by their first name. They may prefer to be addressed as Mr. or Mrs. So and so. Then when you're having conversations, it's important you avoid fidgeting, playing with your hands, playing with your nails, playing with your face. Do not look at the clock while people are speaking, as this conveys that you're in a hurry or you're bored. So be mindful not to watch your wrist watch, or the watch on your phone, or the clock in the room where you're having conversation. Avoid picking at your fingernails or your clothing, playing with your hair, doodling, or using your cell phone while the other person is speaking. As a caregiver, you're supposed to give your full attention to your clients. Be empathic. Try to put yourself in another person's shoes. As this elderly man who is alone, who is not able to do the activities of daily living unassisted. Just imagine what they are going through. And don't say, I understand how you feel. You cannot understand how people feel. You can only imagine, because you cannot know exactly how any other person feels. And then you ensure that your communication aids, such as hearing aids, eyeglasses, dentures are clean and they're in good working order while you're communicating with your elderly patients. And here I have a picture of a very elderly woman communicating with her caregiver with so much tenderness, so much affection and attention. This is what we're going for. Okay, so with this, we come to the end of this lecture. And again, as always, thank you for staying with me. I wish you a wonderful day.